Good afternoon. Welcome to the work session. Today is Monday, December 8th, 2025. It's approximately 1 p.m. I'm Mayor Eric Enriquez. We will start with a moment of silence for the brave men and women of the United States Armed Forces that protect our interests across the globe, and our courageous men and women of the Las Cruces Police and Fire Department that protect our city and keep it safe 24/7, 365. Please join me in the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Where are we at? All right, I think we have pets of the week first. Carol?
Good afternoon. I'm Carol Nelson, Digital Content Specialist with the Animal Services Center of the Mesilla Valley. This week, our dog of the week is Bandit, 91663. I'm a big, goofy boy full of love and fun. At just over a year and a half old, I still have some playful spirit to share, but I'm also a master at settling down for affection. I'm also all about the treats. Seriously, I really love them. My love for treats is helping me learn new things. I've made great strides with commands and have even mastered sitting. I am also known for having a calm and sweet demeanor after some playtime. I'm great with my kennel mates and other dogs. If you're looking for a sweet companion who adores pets and overall a friendly guy, I'm your dog. Cat of the week is Pantera 100563. I'm a sweet and gentle cat who is on the hunt for a loving family. I love lounging in cozy spots and just soaking up affection. When I first arrived at the shelter, I started out shy, but now I purr and enjoy being petted, especially when I can curl up next to someone. My journey has taught me the value of patience. I may flinch at some sounds, but if you go gentle and slow, I'll come seeking all the pets and scratches. And my previous owner says that I'm completely litter box trained and housebroken. If you're looking for a mellow and affectionate companion, I could be the perfect fit for you. And as always, we like to highlight a few of our long-term residents as well. So we're happy to share that after 313 days, Dexter was rescued. So we're super happy for Dexter. But Finn has been with us 311 days, Hulu 309, and Blackberry Pie 271 days. So all really good options. If our pets of the week are adopted, these are good backups. And for our upcoming weekend event, it is going to be our on-site event, Photo Day with Santa Paws, from 1 to 3. So we just ask that you bring an item to donate for our Community of Hope donation drive, and come get a picture with your dogs and Santa. It's going to be a great time. We ask no cats, please, as they are harder to restrain. So only dogs, please. And as always, for more information, please visit our website or you can follow us on social media. Thank you.
All right, thank you, Carol. Next on the agenda is item 2.1, Office of Emergency Management. Amanda?
Good afternoon. Alrighty. My name is Amanda Bowen. I'm your emergency manager, and I'm here today for two reasons. I would like to give you a brief operational update on the Office of Emergency Management, and also to talk with you about our All Hazards Emergency Operations Plan. That is the framework that governs how the city, the county, and our partners manage disasters. The plan is coming to you as policy and governance document, not as a tactics manual, so if you keep that in mind. My goal here today is to make sure that you're fully aware of what it does, what your role is in it, and why adoption matters, and both for legal and financial reasons. I'll start with the All Hazards Emergency Operations Plan. I'm going to refer to it as the AHEOP, just to condense that down a little bit. So when you see it on the slides, that's what I'm referring to. The AHEOP is a multi-jurisdictional coordination framework that we use for large-scale emergencies. It defines who's in charge of what, how agencies work together, and how decisions are made when incidents exceed routine response. It applies to natural disasters like wildfire and flooding, technological incidents like hazardous materials or cyber events, and human-caused incidents including active threats. It's fully aligned with FEMA, the National Incident Management System, or NIMS as it's on your slides, the Americans with Disabilities Act, and the New Mexico state law. Again, not a tactics manual. We're not telling firefighters how to fight a fire. We're not telling law enforcement how to work a scene. We're telling the entire government system how it coordinates to support those operations at a scale. Our prior emergency operations plan dated back to 2011 with some minor updates in 2019. The federal and state standards require a major revision every 3 to 5 years, so that means, quite frankly, we were very overdue for an update. The previous plan lacked many of the annexes that are now considered standard nationwide. It also no longer reflects how our Emergency Operations Center actually functions today and failed to meet current federal preparedness, accessibility, and reporting standards. Updating the plan wasn't optional. Without it, we risked non-compliance, delayed disaster funding, fragmented response, etc. The update process began in May of 2024 and extended out through June of 25. It produced the base plan, 10 functional annexes, 10 hazard annexes, and multiple operational support tools. This was not a desk exercise by any means. It involved multi-agency planning meetings, operational reviews, including many of the City of Las Cruces departments, including Public Works, our first responders, and citizens contributing to the repeated drafts that were developed. We now approach the final steps, and for adoption, that is the stakeholder adjudication, not just your jurisdiction, but all the jurisdictions within Doña Ana County. Next, we do a state-level final review, making this a fully crosswalked, FEMA-aligned, state-compliant emergency operations plan. The plan was evaluated against FEMA's Comprehensive Preparedness Guide 101 version 3. It complies with NIMS and the National Response Framework, meets ADA requirements for accessibility and functional needs populations, was reviewed using New Mexico Department of Homeland Security and Emergency Management's crosswalk tool. It matters because disaster funding and mutual aid are tied directly to the compliance with these standards. The plan focuses on the hazards that are realistically going to affect our community: wildfire, flooding, extreme heat and drought, hazardous materials along our major interstate corridors, pandemics, cybersecurity incidents, and high wind events. Every one of these has either occurred already or is statistically expected to occur again. None of these are hypothetical. Do I need to pause? I apologize.
Yeah, it should just that our screens are going on and off, so.
Got it.
I
You
don't
let me
know
know when
what's-
you'd like me to restart.
Is that
Okay.
like you're simulating an emergency? Just kidding.
We do
You're
that
like,
frequently.
oh, it's a communication blackout.
Just wanted to make sure everyone was able to work through the emergency at the same speed as emergency management is.
It looks like they're back online. Go ahead.
Cool, okay. Again, so these are the hazards that we expect to focus on, and those should be on your screen at this point. None of these are hypothetical. These are things that are realistically could occur in our jurisdiction. The plan outlines the expectation that all incidents start and end locally. Field responders use the incident command system to manage tactical operations. When incidents become complex or exceed routine capacity, the Emergency Operations Center is activated. The EOC does not replace field command. It provides coordination, resource management, emergency purchasing, policy support, public information, and state and federal liaison functions. State and federal support only engages when local government requests it and demonstrates that local capability has been exceeded. One of the most important functions of the Emergency Operations Plan is continuity of government. Even if officials are injured, facilities are damaged, or systems go down, those essential government functions must continue. We do that through orders of succession, making sure those are in place for key leadership, vital records are protected and backed up, alternate facilities are identified, and in short, the plan ensures that government does not stop functioning during disasters. Now, for council authority, a local emergency declaration activates emergency powers. It allows expedited purchasing, regulatory flexibility, and access to mutual aid. Most importantly, it is legally required to request state and federal disaster assistance. If a declaration is not issued, disaster funding is delayed or denied. This is one of the most direct decision points that council controls during a disaster. Now, council's role does not begin and end with declarations. You have an ongoing role, things like approving preparedness funding, setting policy that shapes community readiness, supporting volunteer and nonprofit disaster organizations, ensuring outreach to vulnerable populations, providing visible executive leadership during emergencies. Your policy decisions directly affect how well the community performs under stress. Excuse me. As previously stated, the update includes 10 new functional annexes and 10 updated hazard annexes. This covers everything from mass sheltering and debris management to joint public information and radio interoperability, and lots of things in between there. We also added EOC job aids and community lifeline reporting tools to make information flow faster and more consistent with the way that the FEMA system works. Accessibility compliance has also been made stronger throughout the plan. Next steps include formal plan adoption and promulgation, state submission, multi-agency training on the new plan, public-facing education, and ongoing maintenance. Emergency planning is not a one and done, it's a continuous program, so we will focus on that. And next, because it's been some time since OEM has stood before council, we would like to share with you a little quick review of some of our key accomplishments from the last year. This past year, we broke ground on our new Emergency Operations Center. If you've been by NMSU, you've likely seen the building. It's up on the hill on A Mountain. We're planning to move facilities in May, so we would love for all of you to come out and join us when we do that. Our team responded to 4 federally declared disasters across the state. We supported multiple significant events, including those that happened here in our own community with Vado, Barino, Del Cerro, and Rincon. We also activated the Family Assistance and Resource Center following the Young Park mass shooting, providing coordinated victim, family, and survivor support. We delivered advanced incident command training to regional responders, expanded CPR and AED training with Spanish language outreach, hosted a rail car hazmat response training, and advanced staff through wildfire, debris, and severe weather programs. Training is one of the strongest predictors of operational success during real disasters, and it's become one of our strongest focus areas. And next to that is exercises. We conducted multiple exercises this year from full scale to tabletops, including hazmat, mass casualty, election security, cybersecurity, energy sector, wildfire, agriculture, and flood response. Exercises expose weaknesses in a safe environment, so those weaknesses don't affect us when we face an actual disaster. That's why those are so important to us. We've deployed 45 new interoperable radios regionally, placed a large animal rescue trailer into service, and advanced the county's transition in the statewide radio system. Of course, there's the finalization of the AHEOP, which I just spoke about. We've also started and are almost completed with what we call the AHMP, not to be confused. We love our acronyms in the emergency management world. That is the All Hazards Mitigation Plan. So that will be coming before you to view soon. We managed $16 million in grant funding, updated the city-county emergency operations cooperative agreement plan, and completed a countywide hazardous materials commodity flow survey to better understand transportation risks. OEM maintains continuous coordination with first responders, healthcare, utilities, volunteer organizations, and state partners. We serve on statewide emergency management boards, planning committees, and have advanced automated alerting between dispatch, the EOC, and partner agencies. One of the big steps forward was hosting a countywide water summit focused on shared utility risk. The team developed disaster donations education to reduce post-disaster fraud and waste, and strengthened philanthropic partnerships for disaster recovery funding. Preparedness only works when the community understands it, so we keep at the forefront that disasters are not managed by one agency, but rather by a system. And coordination and engagement have been really key to our successes this year. We have had some changes in staffing. Stephen has moved into county management, county administration. I was selected as the emergency manager to take his place. Joy Chavez, who's here with me, was selected as the deputy emergency manager. And Mansell Pienka continues with our office as the volunteer coordinator. We have added 2 new emergency management coordinators. That is Tim Heydrich and Matt Combs, both who bring a wealth of responder knowledge to our team. Lastly, I would like to say thank you to all of you. The support and collaboration that we've had with the City of Las Cruces this last year has been really amazing. From an emergency management perspective, we view preparedness as a policy decision, and your support in areas like flood prevention, utility infrastructure, target hardening, and things like that have resulted in better protection of life and property, faster response, and stronger recovery. So I really appreciate the opportunity to talk to you and would be happy to take any questions if you have any.
All right, thank you, Amanda. Does anyone have Councilor Graham?
Oh, thank you so much. Just wanted to appreciate the presentation and all of you do, all that you guys do. I know that you hope to never be seen in the community because it's like rarely. I'm glad that we can come in under non-catastrophic circumstances. I'm so glad that you mentioned the coordination of the Family Assistance Center after the Young Park tragedy, because if you didn't, I was going to bring it up, because I feel like that's such a good example of what you do in the community. Like you said, you do a very technical job with a lot of acronyms and a lot of people, you're just kind of like, oh, okay. But seeing you in action, coordinating everything from payments to victims to just bringing out dogs and trying to heal hearts was huge. And I'm on the record here saying if you need me for future interview panels, I'm going to have a lot more free time coming up soon, so I hope you'll keep me in mind. And it's great to see you here today.
I appreciate you saying that on record. Thank you.
Thank you so much. Thanks, Mayor.
Thank you. Councilor Corinne.
Thank you. Thank you. I just also wanted to really give you all an enormous appreciation for all of your work with the Family Resource Center. I think you also worked behind the scenes with the Animal Services Center and gave a lot of support with them and thinking about their emergency plan and the collaborative emergency response plan for animals. So I want to thank you very much. I did want to follow up on one specific thing that isn't actually for you. Thank you. That's mostly what I have for you. But when we first came on board as city councilors, we went through a little bit of an orientation with the Office of Emergency Management, and that was great. I think I highly recommend new councilors or new elected folks also go through that. But one thing came up in that conversation that I never followed up on, and I don't know that any of us ever followed up on, and that was increasing the city manager's ability to spend money in an emergency. And historically, the council had set that at $100,000, which may have been real money in the past, but isn't actually real money in today's emergencies, I think. And so that was like 3 years ago, and I had it apparently on a hidden Post-it note in my brain that had been lost until you came here today, Amanda. So thank you for bringing it back, because I don't think we've ever considered that. I don't think we've made that move to increase the authority of the city manager in the case of an emergency to spend more money on behalf of the city of Las Cruces. But I would like us to, I don't think it would be a very big policy lift, but I would ask us to actually maybe consider following up on that if we can. Just seeing you reminded me that that's a thing that we should do to make sure that we're contributing meaningfully to this. So, and maybe I'm misremembering, I don't know. It was years ago. Again, forgive me, but thanks for being here, Amanda.
Thanks. Councilor Flores.
Thank you, Mayor. Thank you so much for your presentation. Do you remember the last time you were here or your organization was here?
I believe it was about 1.5 years ago when Stephen presented. It's been a bit of time, and I apologize for that. We've been shuffling people and things, but we do hope if you will allow us to come back yearly to provide you with some more consistent updates.
Okay, I was just wondering, because there was a date that came up, 2011, in the beginning, and what was that for?
So the AHEOP, the plan that I was discussing, the last really substantial rewrite of that plan was done in 2011. We have done some minor tweaks to it to keep our office compliant so we could get grants and things like that. There was a signature revision in 2019, so that's the official date of the plan that is on file currently. But we knew that it needed more significant updates, and it needed some, for things like adopting ADA compliance issues. Those are really important, and we didn't want to gloss over that by doing non-substantive updates to it. And so that's why we went with a full rewrite this time.
Oh,
And that's
that's
what
good.
that date is referring to.
Well, that's really good, because then your funding isn't at all jeopardized.
Yes, ma'am.
Enhanced. Thank you very much for your work. Thank you.
Thank you.
Mayor Pro Tem.
Thank you. Thank you so much, Amanda. It's good to see you again. It's just really quick. I thought it was funny that you said the acronym was to condense the name, but even the acronym is kind of long. So I just thought that was funny. I just continue to be really impressed by yourself and Joy, and especially in the aftermath of the Young Park shooting. And so I just really wanted to thank you both for that and how quickly you moved. I am curious if, something you said during that day when we visited you at the resource center, you said, you can plan and plan and plan, and the only way to know if the plan works is if something happens, and you never want something to happen, right? But that's just the way it goes. I'm curious if, in the last few months, you've had time to debrief, and if you have any lessons learned, certainly for yourself, but anything that the city could have done differently or better. I think that that's really important to, and maybe you've already shared that with, like our chiefs, but if there's anything you could share with us today, I think that would be important. And if not, because I'm putting you on the spot, then if you can follow up, I think it's just really important. Debriefs are just so important for learning and for, doing things differently. Hopefully not a next time, but certainly if a next time should occur.
Absolutely. So we did conduct an after action of the actual Family Assistance and Resource Center process. I believe that your team did a after action report of other parts of the incident. Ours was specific to that as that was our scope. And we had a lot of entities show up, a lot of participants show up. And I think the biggest takeaway that I heard from the room was really the amazing way in which people stepped forward with a very little ask, and how the pre-planning made such a big difference to executing. There are always little tweaks and things that we feel could be done better. I think there's some improvements to the plan that have already taken place. Joy could probably speak better to that, but the big takeaway was really in collaboration and really continuing to exercise that moving forward with our law enforcement and fire partners.
Thank you so much. Again, I really appreciate you both, and I think it is also important that we will have 2 new colleagues on the council in January, that they meet you all and go through some sort of introductory presentation.
We would love to provide
Yeah.
that, absolutely.
Thank you.
Yeah, thank you, Amanda. Is there anyone else? Again, thanks again with the Young Bark incident, but also for Ruidoso. When Ruidoso was hurting in the flooding, you all also were there and providing assistance and knowledge and experience. But those kind of emergencies also create education. So thanks. I'm sure it helped with the plan and putting things together for our community in case something happens. So thank you for your efforts. And I just want to say thank you for the update on the new facility. You said it'll be in May?
Yes, sir.
Okay, so as already been mentioned, we'll have 2 new counselors coming on. You can do the introduction and show them, but I would hope that sometime in June, give it about 6 months, get established, and then invite us over so we could get a tour of the new facility and how it works, and another tutorial on the expectations and the role of counselors is always important. So
Absolutely. If you give us a minute to talk, we'll fill your ears as we have previously. So we would love to collaborate to the fullest extent you invite us in. So appreciate it.
okay, thanks. And as far as the funding and things, I do recall something like that that took place back then, Councilor Correa. But I think that's something that our city manager could get with the county manager and yourself and see how we can work through that as it's a shared entity?
I believe we've worked that out. We do have a new cooperative agreement that's been signed, and so that's all in place. We really appreciate the willingness to work on that. Our team was working really hard to provide your team with a lot of backup data, and a standard reimbursement amount really made more sense, and your team accommodated that, so thank you very much. That should be in place now.
Okay, thank you, Amanda. All right, thanks. Next is item 2.2, the MIH Light Program Update. We got Matt Hiles, Wes Smith, and a group of others.
Good afternoon, Council, Mayor Pro Tem, Mr. Mayor, Matthew Hiles, Cruces Fire Department Division Chief. We're here to present an update on the light program and what it's doing now, what it's been going through, what it's experiencing. And Wes has done an amazing job with putting together a lot of data and fine points to show Council today on where things are going and where we're trending and what we would like to see. Also an update on the mobile integrated health program and everything that it's going through and the changes and what we're seeing out in the community whenever we go and do visits with those individuals and the underserved. So at this time, I'm just going to go ahead and bring up Wes Smith. He's our case manager for the fire department.
Can I start with the mobile integrated health program? Or is that, because it's on, here we go. All right. Okay. Mr. Mayor, Council, Wes Smith, Las Cruces Fire Department Case Manager. Super excited to be here. I get really excited when I talk about my programs, and I get really excited when I talk about statistics. So if I start talking really fast, I apologize. But I do want to start with a brief comment on policy. The Rural Health Transformation Program was authorized recently and empowers states to strengthen rural communities across America by improving healthcare access, quality, and outcomes by transforming the healthcare delivery ecosystem. This model has a heavy focus on EMS and community paramedicine. That's about as scripted as I'm going to try and get. So, the Las Cruces Fire Department Community Risk Reduction Program has been incorporating this since 2017. Council's been backing this. This is just a change in policy affecting the federal government that the city has already been established for the last 8 years. So it's super exciting to see that we're kind of on the forefront and kind of the model of this administration of programs. I want to take a moment and talk about who we are. So we're led by our battalion chief, division chief, Matt Hiles. We have a licensed clinical social worker supervisor, Allison Stoner, who says she's watching on television. And then we have our MIH coordinator, the Paul Ford. And then we have Dan Howard and Chris Olison as our MIH team. So Dan is a firefighter paramedic, and Chris is a licensed clinical social worker. And down here at the bottom is a case manager, that's me. So I kind of want to paint a picture of an MIH patient. So the youngest MIH patient we've ever had was 2. The oldest was 108. The average MIH patient is about 70 years old. But given a standard deviation, we're looking at a patient is anywhere between 60 to 80 years old. When we break it down by race and ethnicity, we see that white identifying patients far exceed all other race and ethnicities. A rigorous chi-square analysis was done in the winter of 2025 that confirmed this disparity and exceeds the population that we serve. So the population that MIH serves does not reflect the population of our community. What that further shows is that an active pursuit of cultural competency is required for this program. When we look at by gender, there are no remarkable findings by gender. We did a cross-section analysis of patients by chronic illness and mental health diagnoses. Less than 5% exclusively had a psychiatric diagnosis. About 10% exclusively had a chronic health condition. However, 85%, or almost all, had a chronic health condition and a psychiatric diagnosis. This finding confirms that we take on the most complicated cases facing very difficult conditions. That was a really fun study. So any organization, whether it's a small business or a Fortune 500 company or an MIH program, it needs to know what its referral sources where the referral sources come from. So fire kind of comprises the majority of our referrals. Shown in red, they're considered internal referrals. These are often repeat 911 utilizers with an established relationship with the fire department and are experiencing some unmet need. Their primary access to healthcare is through the 911 system. So what you see is somebody has a stomach ache, they call 911 instead of going to their primary care provider. They go to the emergency department, they get that acute need met, and then they go home, they don't follow up with the primary care provider, they have another flare-up, and they go to back to the emergency department. So kind of what we do is we try to mitigate those excessive 911 calls and find out what that unmet need is and get them the proper care that they need. Referrals from LCPD include patrol and CIT officers, but also animal control and codes. These referrals often accompany with like a mental health component. Government agencies include courts, Las Cruces Utilities, the library, and Roadrunner Transit. It's important to point out that the transit system doesn't have a social services program. However, their drivers and staff really know their riders. And so they can see a change in their activities of daily living, and they'll call their supervisor like, hey, I was going to pick up Mrs. Adams, and she had difficulty getting from her wheelchair to her rollator or walker. And the supervisor will give us a call, and we'll try and find out was there a change in her medication? Was there some sort of change in condition? What do we do to maximize her independence so that she can stay home and stay home successfully? Referrals from families and friends. These are exclusively word of mouth. So these folks are referred by previous patients and family members. The fact that so much of this total is found in this category makes me proud to work for MIH. This is a true satisfaction survey. So you want to know how well you're doing? Well, your friends, the family and friends of the patients that we've worked with, refer to other families and friends. And the fact that it's such a large portion of the referrals, that gives me confidence in the work that we're doing. And then referrals from health and human services. These include hospitals, skilled nursing facilities, physicians, adult protective services, and our dear friends and senior programs. So these are our $1 million referrals. They're incredibly complex. They take a significant amount of time, resources, and collaboration. It's also where the healthcare system truly unites. We talk about how siloed the healthcare system is. That's one of the things that we mitigate through our program because we have those established relationships, and we can work with folks across the healthcare continuum. It's pretty wild. All right. So an MIH referral can be found ineligible, typically for 3 reasons. There's no MIH need, we are unable to locate the patient, or they're out of our jurisdiction. Out of our jurisdiction, so folks will have their emergency in City of Las Cruces, so we get the referral from within the community, but it turns out they live outside of our jurisdiction, so we'll try to case manage them either over the phone or try and access resources in the county to get them linked up with as best we can. A referral may be revoked due to safety concerns. So sometimes we don't have the scene security necessary to continue with that patient. So we'll try to deliver services via phone and email, and things like that. Deceased patients are those we've lost while under our care, including hospice. Refusals are those patients who agreed to a needs assessment. A treatment plan was started, but for various reasons, the patient chose not to continue with the treatment plan. Graduated patients include those that were enrolled, followed the treatment plan, that have included resources provided by MIH and referrals to outside agencies, and then the team agreed that all reasonable interventions had been navigated. And then to relate MIH graduates as a performance measure, imagine MIH as a business where 80% of all referrals result in a sale. That's unheard of. It's an excellent conversion rate, sorry. Just stuck to the script. But that's a good conversion rate. All right. So some of the things that we do measure, the number of community health visits was 890 separate visits, with 1,739 interventions, where we either provided the resource or referred to some outside agency. So typically any patient that we work with gets 1 to 5 referrals or resources. 86.8% of the patients we worked with had a reduced 911 usage. 53% as of November 15th, all the patients that we worked with in FY25, half did not have a subsequent 911 call. And then the average time, so whatever folks do have another 911 call, it's 82 days after the fact. So if you think of like the 30-day rehospitalization rate, we're beating it. These are super awesome to me. So future plans and growth. We did hire an LCSW supervisor position. Allison Stoner says she is watching online, so hi, Allison. We do have the Light MIH headquarters fully funded through HUD funding and state legislative funds. And then community partnerships and education. Paul Ford has more education programs to provide to our community. So we're talking to seniors about fall risk. We're talking about medications. We're talking a whole slew of education that Paul Ford's able to provide. And we'll be continuing to do that. Super exciting. And with that, I'll stand for questions about the mobile integrated healthcare program.
Thanks, Wes. Councilor Flores?
Yes, thank you. Thank you for your presentation. On page 9, there was an 80% success rate measured or reported on page 9. But thank you. So what does it take to graduate? And then the recidivism is also a factor here.
Okay.
So there's a 20% of those measured come back, the other 80% don't. Over a period of how much time was this data collected?
Okay. Mr. Mayor, Councilor Flores, the 80% graduated are folks who were referred, enrolled, and we administered at least one resource or one referral, maybe up to 5. It really depends on the severity or the acuity of the patient. So sometimes it's a very simple fix. Sometimes it's just navigating somebody to have their own wheelchair that they can't afford. Sometimes it's getting adult protective services involved. Sometimes it's navigating somebody through a skilled nursing facility and getting them inpatient rehabilitation. Sometimes it's really pulling like multiple agencies to get somebody engaged and be successful independently. And so that 80% captures those folks that require some sort of interaction. The other 20% are typically they refuse services, they're deceased, revoked, or ineligible.
Well, I can understand the deceased and the refusals, but the revocation and the ineligible, what happens to them? And what are the actual numbers of those percentage points?
I have the percentage points, I don't have the
Oh, okay.
actuals.
So, I mean, in terms of the percentages, it looks like it's very successful. You have no idea what happens to that 2.6%. I'm just wondering. And is it just ineligible? What's the eligibility requirement?
Mr. Mayor, Madam Councilor, so if there's no MIH need, this is a situation where perhaps by the time we do our needs assessment, that need is no longer applicable because they've gone to a higher level of care. That might be an option. Or family came into town and they took over and they're able to meet the patient's needs.
And what about the revoked? Are they referred to another entity?
Mr. Mayor, Madam Councilor, revoked is often for like safety concerns. If If it's
Someone's violent or,
yes, ma'am, if we're not
dangerous?
able to successfully intervene in a way that doesn't put our staff in danger.
okay. And then, well, and then you have 3.8 who have died, so that's explainable. And I had another question, but maybe it, it drifted away. Lucky you.
I'll be
Anyway,
here.
but no, but thank you very much for the reporting, and thank you all for your work. It's crucial. Thank you.
Anyone else? Again, Wes, thank you, and everyone, the whole team, but a special shout out to Paul. Paul was there from day one, from the beginning, and your continued efforts and work. Thank you, Paul. All right, now you're going into the next.
I'm going to interrupt Wes really quick because I have a 2 o'clock meeting. And I'm going to try to get through this. So you all know me, and you know that I don't cry, and I'm usually super vivacious, but I'm here to share my story. So, good afternoon, Mayor, Mayor Pro Tem, councilors, and this entire team. I'm not here in my community non-for-profit role, but as a citizen of this city. Over the last 8 years, I've been caregiving for my parents. As an only child and living close by, I knew this would be my role, but I was not ready this early in my life while balancing children, work, general life, and just overall schedules. My mother has dealt with My mother has dealt with a dozen falls, a car accident, 2 knee surgeries, and has been in a wheelchair for 4 years. As caregiving took a toll on my father, it was apparent that his health, his mental capacity, and PTSD as a Vietnam veteran was turning a corner I could not assist with on a daily basis. As an active member of the non-for-profit community, I feel really connected. I'm so well connected that I know the resources and services that you provide here in the city of Las Cruces. It was through these resources and connections and outreach that my family was truly impacted by this team and so many others at the city and continue to be served. The medically integrated health team began helping my parents roughly 4 years ago after a physical altercation with my father and I. Several fall assist calls to 911 and many visits from Station 2. So Chief Daniels, thank you to your department at Station 2. I've gotten to know them very, very well. I needed support to keep them out of the ER on a regular basis and stop calling 911. Paul, Wes, and Mindy, and all of this team behind me assisted my parents and placed them on a regular MIH rotation. They assisted with check-ins on my dad, discussing of getting firearms out of the home, fall protocol, assisted with trying to get my dad onto VA services, setting my parents up on Meals on Wheels, discussing setup of VAMOS to assist in transportation. And if you ever need me to talk about VAMOS, I probably won't cry as much, but it's an amazing service, and thank you for doing it for free for our community. But most importantly, it was another set of eyes so I could keep my parents safe in their home. This has been invaluable for them and for me. Unfortunately, my father decided to take his own life in June. MIH, VAMOS, and LCPD were all there to assist me in a situation that I was not prepared for, but unfortunately knew may come. Even with discussions on getting firearms out, alerting fire and PD of the potential danger and seeking additional mental health services, the act still came to fruition. I want to personally thank LCPD and especially Officer Monsivais for his care during that difficult day. I'll tell you a funny story. Officer Monsivais is not very tall, and he met me at the door and said, "I don't want you to have to see what is happening, so I'm going to walk with you. And I thought, that's so sweet because I can see over the top of you. But he held my hand and he helped me get through that situation, and thank you to him. Days later, MIH was there to help my mom get a Knox box on her door, complete VA paperwork for survivor benefits, and talk about how to keep her at home. Paul and I talked for hours, Mindy and Wes, in support of possibilities of assisted living facilities or keeping her safe at home. It is with their help that I've been able to do so for the past 5 months. I could not have done it without their guidance. I want every citizen, every single one of you, and every family member in Las Cruces to know about these vital services provided by the city of Las Cruces. From MIH to the free ride services of Vamos to Meals on Wheels and the support that PD and fire give to our community even on our blue sky days. I want the council and the chief of fire to understand the importance of MIH and its staff. These are amazing people that take on situations to reduce 911 calls, unneeded transports, ER visits for our residents, and connecting families with resources they need. With support from their team, including the importance of a social worker, families can get through issues and reduce their needs for 911. I am full support of this team and hope that in today's work session you feel the same way. Thank you all so much, and thanks for listening.
Tara, thank you. Thank you for sharing. Thank you for your testimony of MIH and how it's valued in this community, and we all share that. So thank you.
Mr. Mayor, Council, Wes Smith, Case Manager, Las Cruces Fire Department. In this presentation, I'd like to provide a brief history of how the Light Program was established, reintroduce the framework of the staff and their roles, what they do and don't do, provide a review of what was seen in fiscal year 25 and what we see on the horizon. In the summer 2016, Battalion Chief Cody Haver conducted a study on fire department-based mobile integrated healthcare programs. In the fall of 2016, the MIH pilot program started. February 2017, In February 2017, the pilot program report was submitted to City Council. In 2018, MMC resident physicians started a ride-along. And in 2018, NMSU School of Social Work started an internship program. By March 2019, the MIH program was formally established. In 2021, the Overdose Outreach Program was established, pairing a firefighter paramedic with a master level social work intern to do Narcan leave behind with patients who had previously experienced an overdose. However, the team chose to also link patients to recovery resources. So the idea of the grant was just to do like a Narcan leave behind after somebody had experienced an overdose. These folks went above and beyond to take the next step to actually lead them to recovery resources and treatment. In July 2022, Operation Bluebird, which includes the MIH team, partnered with an LCPD CIT officer, were set together to visit patients with a significant mental health concern that required scene security. So the mobile crisis response is within the 911 system in the city of Las Cruces and Las Cruces Public Schools, dispatching a team composed of a social worker and a firefighter paramedic to mental health and behavioral health crises. The structure of the Light program includes our battalion chief, Matt Hiles, Allison Stoner, who assures me she is watching from home or from wherever she is. I think she's on a plane somewhere. And then 2 Light teams. So I want to point out Karina, who is our firefighter paramedic, hiding, and Mindy, our licensed clinical social worker. Those 2 make up Light 1, and then case manager. It's me, Wes. Hours of operation are Monday through Saturday. We're in service from 8 to 7. We have 2 teams working alternating shifts on a 40-hour schedule. So we have an LMSW is required. It just turns out that all of our social workers are LCSWs, which is a little higher credential. And then the firefighter paramedic is trained in trauma-informed care, crisis intervention law enforcement training. It's a 40-hour law enforcement training program. De-escalation, motivational interviewing 1 and 2, and then nonviolent crisis intervention. The roles of the firefighter paramedic include the medical assessment, so they can check blood alcohol content, vitals, blood sugars, and then collect past medical history. And they should review current medications and see if there's any interactions that may be affecting the situation on the scene. The role of the social worker includes a comprehensive assessment, such as prior psychiatric history, the event leading to the trigger, assess for suicide risk using various modalities, and then identify healthy coping strategies. They can treat in place using brief behavioral health interventions. The roles of the team include being present and offer a calm demeanor. They recommend possible follow-up care, transport to definitive care, connect to resources for food, shelter, transportation, and healthcare. Light does not sign certificates of evaluation, does not accept referrals. We do not provide long-term counseling or case management services, and we do not respond to 988 calls. Now, there are caveats to each of these. So we don't sign certificates of evaluation. However, we do respond with PD, who is still capable of taking somebody into protective custody if necessary or appropriate. We don't accept referrals. However, when you do call 911, you can kind of explain what's going on to dispatch and request a light team to be added on. We don't provide long-term counseling or case management services, but there is a case manager as part of the team to do follow-up after the incident. And we don't respond to 988 calls. However, a 988 call can be escalated to the 911 system, and then light would then be dispatched. However, that is very few. There's only been like 6 cases in 2 years where that's actually happened. The last time I talked to 988. Call types include behavioral issues, suicidal subject, suicide attempt, overdose, CPRs, and deaths. There's 15% on this screen that talks about other. These are situations where either PD is on their way to like a welfare check and they've requested a light team to be added onto that call, or a fire crew is out and they're assessing the situation. They think light would be an appropriate response to add on to this call. So it's kind of like the ghost category, folks who are like know that the light program is appropriate for what needs to happen. Let's talk about behavioral issues. A significant amount of behavior calls include restless and agitated patients. We find a significant amount of patients are combative, violent, angry, homicidal, or experiencing strange or bizarre behavior. But many patients are anxious, stressed, and irritable. Behind hallucinations, depression-related behaviors are also common. This chart shows half of the patients are adults between the ages of 19 and 55. However, it also shows half of our patients are underserved populations. The growing geropsych population is evidenced in the prior presentation on MIH. The revelation of the youth population resulted in a 2-year retro study and analysis by myself and Mandy Fowler. We reached out to many community stakeholders, identified gaps, and used that information to improve our responses to adolescents. Imagine that, using data to change policy to make your program more effective. Crazy. Dispositions. Okay, so we pulled it down by quarter for what we were working with our patients. So this just really shows that more than half the time we treat in place, which is the goal and the objective of the program, to de-escalate and get people to de-escalate them and get them the care they need. Now, when we do transport, the blue bars shows transportation to the emergency department, and then the orange is transport to definitive level of care. So of course we want to pull away from the revolving door of the emergency department, and we want to continue to provide transportation to definitive level of care. This could be like Peak Behavioral Health. This could be Mesilla Valley Hospital. This could be the Crisis Triage Center, or this might be a family member that's supportive and capable of meeting their needs at that time. So we looked at police, Las Cruces Police Department, Las Cruces Fire Department, and AMR when that was going on. So again, FY26, the first quarter, is the last time that we looked at this. These are the times, the percentage of times that we've canceled PD which is typically anywhere between 30 to 50% of the time. There's been times where we have asked, we've kind of talked with PD about it was appropriate for them to move on. And they're like, no, we're going to keep an eye on you for a little bit longer. And so that's kind of the relationship that we have on scene. Likewise with fire. But we kind of see in the last 2 quarters, it was pretty much I think they were getting a lot more comfortable with that disposition, canceling in those situations. This is kind of like my workload. So I get anywhere between 10 to 30 referrals a quarter. It's manageable. Relevant data. So time on task is 1 hour and 18 minutes per call in FY25. This is a decrease of 40 minutes year over year. The mean emergency department or detention diversion was 72.9%. These are folks who would have otherwise been transported to an emergency department or a detention center had there not been a light unit on scene. Recidivism, 89.9% did not have a subsequent 911 call. And then response to mental health crisis was 58.2%. This was 9 percentage points higher than the previous year. And so super excited about that increase. Okay. So I also want to briefly talk about the contribution to the national discussion. In March 2022, we sat on a panel discussion with Mobile Integrated Health, the Opioid Overdose Outreach Program, and the Assisted Outpatient Treatment Program through Doñana County. That was done in Albuquerque. We did 2 presentations in Spokane, Washington. Allison Stoner did a presentation on battling the blues, and Mike Torres did a presentation on the evolution of a social medic. So this is the idea that a paramedic can pivot and have that social worker mindset in the field. Super exciting. Hiles presented, that was a panel discussion, navigating the crisis continuum of 988. He was the only one from 911 at that conference. And then the presentation FRI, I think Chief Smith was on that one. I did a poster presentation in Tampa. And then this summer we did You're Grounded, at least we hope you are. It was a first responder. Come on, this was a joke. And then we got accepted to present in Dallas next summer for using data to drive partnerships and improve child and teen mental health. Insights from Las Cruces Fire Department Mobile Crisis Team. This is a paper Mindy and I were working on from the work that we did with that 2-year retro study. And then Mindy has a presentation for NASW pending for Washington, D.C. Future growth. We have the clinical supervisor position that started in October 2025. The light social worker overtime that was approved for FY 2026. This is going to allow us to expand our times in service. So this is going to really increase the amount of calls that we're able to go on. So thank you for that. Light MIH headquarters is fully funded through HUD and legislative funds. Community partnerships and data sharing is in process. So we're continuing to take the data that we've done over the last few years, share with the community, and get more feedback so we can improve our programs. And it's really exciting. Cool, and I'll stand for questions.
All right, thanks, Wes. Appreciate it. Councilor Grant.
Thank you, Mayor. Thank you so much. I feel like any slide in this presentation is just clear justification for, both celebrating this program and expanding it. But can you jump back to slide 18 for me, please? Perfect. So I think this is just such a great overview of how well this program is doing, but also how much more we could use it. So you're responding to 58.2% of all mental health crisis calls in the 911 system with a goal of 90%. But when we look at bullet point 1, average time on task of 1 hour and 18 minutes per call. And that's amazing because that's the time it takes to successfully engage with these patients. But it also shows even when a light unit is available, if they're with a patient, they're going to be there for a while. And if we're going to get that fourth bullet point up, and I really appreciate you pointed out the progress that's being made, we just need more of you. And I just pointing out, since my time here is fast. I know every time I say this, everyone's like, oh, you make it sound like you're terminal or something. But no, just because my council term is about to be over, so it's not anything deeper than that. You know, and I don't think I have to convince anyone on this dais or the folks who will be joining us in the future about how important this program is, but I just wanted to call out this one in particular. And again, thank you all so much for all that you do. Thank you, Mayor.
Councilor Corinne.
Thank you. Yes, I echo the fading Councilor Graham's. No, you're not fading. I'm just kidding. Gratitude and appreciation for this, both the way that you've analyzed it. I appreciate the nerding out. So I see you using your data. So I appreciate you all for that, and for the essential work that you do in the community, which is actually important to talk about, but the data is the least important part of what you all do, I think, in terms of contributing to things. I'm curious, I'm actually sort of asking for you to speculate a little bit, which I know no one ever likes to do when they're doing these presentations, or talk a little bit about the horizon. You sort of alluded to some of the horizon, but I'm curious if you have a sense of two different variables that I think really relate to your work. One is the frequency with which these calls are coming in, if that's trending in any direction, and then secondarily, the providers or lack thereof that exist to do follow up on almost any version of both MIH's and Light's work requires a very robust network of people to be sort of handing people off to and understanding how that works. And I'm curious if you can talk about, again, this is speculative, this is not, I'm not asking you to give a full epidemiological study, although I would love that and support it. Just what's your sense of both of those things in terms of how it relates to this work and the future of both MIH and Light?
Mr. Mayor, Councilor Karam, thank you. So we work with a lot of other agencies, including HIDA, DEA, PD, obviously, and we're in a lot of conversations with a lot of community stakeholders, like the LC3 Behavioral Collaborative, and so we're constantly being educated on trends, not just in numbers of like frequency of calls, but like what are contributing factors that are going to lead to more calls. So this may be a change in policy, this could be change in administration, could be change in there's a lot of things. So there's nothing that we're really able to like track and trend outside of like basic volume statistics.
I guess part of the reason I ask this is because sometimes when people become more aware of something, they end up calling more, right? Like, so if the trend is to increasing numbers, whatever the origin of that is, or if fewer people are calling, right? So I guess those are the kinds of things that I would be curious to know, and you might not be able to say that, but I think what you're getting at is it's too complicated to make any speculative pronouncements about what I'm asking.
Yes, ma'am. Yeah, maybe more. I have some ideas. Let me talk to my chief, and I'll have him get back with you. But as far as lack of providers, I do appreciate that you do appreciate that there is a paucity of providers in our community. But a lot of what we do, it's not what you know, it's who you know. And that's why this community engagement and reaching out to folks and like kind of like sharing our experience with like mental health crises and getting feedback from providers. We're learning all kinds of different other programs that may be appropriate for, especially like youth. When Mindy and I were going through this research, we were able to identify all different kinds of like avenues and like strategies to get children connected with resources. So it's what you know, or who you know, rather than what you know.
Awesome, thank you. I guess the danger of knowing a lot of people is that you get better at your job and then more people call you and then there's more demand. So just to speculate myself, I think you all are in danger of becoming both really ever better at your jobs and ever more in demand. So I sense that that's on the horizon of the future of these programs. So, which you have contributed to today, for better or worse. So thank you again for chatting. But I do hope that you'll consider, when it comes to things like collaborations, if there are any ways that we can support those, or if there are trends that are happening in the community, because we've heard distally of things ending, right? Things in the community, resources that have existed that are becoming fewer and fewer, right, in number. And even as, these are all very downstream things, even like the professionalization of social work, right, and ability to get your loans reimbursed. Those things affect every aspect of your job, right? And so as you sense trends that we can help offset or contribute to overcoming those humps or addressing things that you all are affecting, I hope you'll let us know what you need as ever, please.
Mayor Pro Tem.
Thank you. Thank you so much, Wes, for your presentation. You're a wonderful presenter. I know we were on a panel a few months ago, and you're very nervous. I don't know why you would be. You're very great. So just have to say that. Couple of notes, just a couple of thoughts, and then a couple of questions for you. I wanted to circle back to something you said in the MIH presentation about transportation not having a social services department, yet our bus drivers being incredibly attuned to their customers. I thought that was really beautiful, and I'm really glad you put that into your presentation, because again, the data, that's very important. That is how we should be creating policy and programming and funding. And there are some things that the data doesn't capture. And so I just really wanted to express my gratitude for that, because I think there are, little miracles and magic happening all over the city all of the time. And we keep hearing that from our bus drivers. So thank you for noting that. These two presentations for me just continue to affirm just the belief that we should always be pairing the right first responder to the right emergency. And, these two programs are the epitome of that, right? And, for a long time, I also have heard that we should not have a co-response model for light through the 911 system, right? That is some of the models across the country, right? And I used to believe that too, until I went on a ride-along and got to sit and talk with the folks that are doing the actual work and who have said, I don't know that that's necessarily something we needed. We've seen a lot of really positive things come out of the 911 program. For example, the social workers on the light team have seen a police officer regulate themselves in the middle of a scene. And again, things that the data doesn't capture, right? And so I think it's so important for all of us, for us up here, to just continue to be in conversation with all of you here for sure, but just directly come to you all for information about how we can support the programming and not make demands that perhaps isn't what you want to see. And so I just want to note that, because I think it's incredibly important. Just a couple of questions I have. When you talked about 988, I am curious what kind of, and maybe this is in the future or you're already working on it, what kind of data are you getting from MIRVDA and from 988 because I'm so curious about what you said in terms of, the escalation. 988 calls can get escalated to 911. I am curious, you said that's only happened 6 times in the last year. That's really interesting to me, right? Maybe that's a good thing, I'm hoping. I would be more curious to learn about that. And that might not be from you, I guess that might be from MIRVDA next time we see them as well. But I do think that's really important. And then, I'll stop there. I don't know if there's anything you wanted to add to that, Wes.
Mr. Mayor, Councilor Rincon, Mayor Pro Tem, I can get you in contact with the 988 folks that we work with and they're a great resource.
Yeah, that'd be great. Thank you so much. And then on page 16, I think, just so that I'm clear, you talked about the canceled. That is, so for example, LCPD, that's, you arrived to the scene with LCPD 100% of the time. So, and you're saying that these are the times where you said, okay, LCPD, you can go, and LCPD was like, yep, that's, okay. Same thing with fire, I imagine, like ambulance or the entire apparatus has shown up, and then you said, nope, everything's good. Same thing with AMR or ambulance service, that they showed up and then you canceled it, or how, am I getting that right?
Mr. Mayor, Madam Pro Tem, I want to say that sometimes even AMR will be canceled en route.
Okay, yeah,
Like fire can be canceled en route, but typically PD is always establishes scene security.
okay, I was just curious. Thank you so much. Yep, no, that makes sense, thank you. And then my last question was, I think for Kyle, I am curious about, or Public Works, I am Kyle interested about the update to the building and where we are in terms of, I know we have full funding, and I would love an update on what's next. I'm so sorry? Jimmy, I'm so sorry. Not Kyle.
Jimmy Moreno,
Sorry,
Public Works,
sorry,
for the
Jimmy.
record. Mayor Pro Tem Bencomo, we're approximately 90% on the design for the building. Also, the plans are currently in review with SHPO, which is the State Historic Preservation Office. Since the old Fire Station 3 is greater than 50 years, and because we have a HUD grant, we have to go through that process. So we're hoping to get some resolution on that by the first quarter in 26. So, but the design is going well. We're almost completed with that, and then we'll move forward accordingly.
That's great to hear. And then Jimmy, just to make sure you're connecting with the Light and MIH team for, like, you know, their needs and, you know, making this.
That is correct.
That's amazing.
Sorry, Mayor Pro Tem Bencomo, that is correct. We, our team coordinates with them, with our user departments, make sure that all their needs are met in the design and construction.
Awesome. Thank you so much. I appreciate it. Those are all my questions. Thanks again, Wes, and to all of you for all you do.
All right, well, thank you for that, Wes. Thanks. As you said, super exciting. I think you said it several times. So a lot of exciting news, a lot of growth, and I share that with Councilor Coran that, you know, as you become more known and the great work that you do, you become more in demand, and it is true. But the beauty of all this is that this started with 911 calls, so people can always call 911 and still get the fire department and police department out there for their needs. But thank you for all your work. We really appreciate the presentation and the update. So next on the agenda, 2.3, legislative policies. And I believe Larry Horan, is he on?
I'm sorry, Mayor, I forgot to mention that he had a family emergency, so he wasn't able to jump on.
Okay, no problem.
Mayor, City Council, Christine Rivera, your city clerk. So today we have legislative policies that we're advocating for in the upcoming legislative session. This presentation will be in multiple parts, given by multiple departments with their policies, and then we'll open it up at the end for questions. And so first up today is the airport, and we'll bring up Andy Hume.
Good afternoon, Mr. Mayor and councilors. Good to see you all today. My name is Andy Hume, and I have the privilege of serving as director for our airport. The policy that I want to just touch on a little bit this afternoon is the Rural Air Service Enhancement Grant Program. This was a program that was passed by the legislature in 2022, and it's modeled very much after the Essential Air Service program that is run by the FAA. It provides financial support for passenger air service, and in our case, just for the state of New Mexico. Right now, we have our passenger air service between Las Cruces and Albuquerque, and very soon we're looking to transition our service from Albuquerque to Phoenix, so we'll be looking forward to that in the very near future. Over the course of the past 3-4 years, we have received financial support through this grant program. In our first 2-year cycle, we received $3.5 million total with a 10% match that you see there. Over the past 2 years, and there'll be a grant application, a grant award coming to you all the first part of next month. We received $1 million in 2025 and again in 2026. I'll come back to the reason why the difference in funding in just a little bit. As I noted, certainly there's financial support from the New Mexico Department of Transportation through the state legislature, but there's also a match that is required. Up to this point, we have had an ongoing agreement with New Mexico DOT that has been amended, and that original contract has been with a match of 10%. For future contracts, we may see that match go up to 20% should we continue to participate in this program. So what benefits have we been seeing in this program? Well, I've had a chance to talk with some various folks, and also we've done some surveys, and really there's a wide variety of individuals who participate in this service. And so I just have a quick list of individuals who have participated. I've actually had a chance to talk with some folks. I myself have taken the flight a number of times, and particularly when I'm going north to advocate on behalf of this program to our legislators. And actually had a chance to talk with folks who use it to see their family more often, for instance, when they, with their family members that live in Albuquerque and they live here. So a wide variety of reasons why, and this provides just an additional method of transportation. And let me tell you, it really beats a 3.5-hour drive from here to Albuquerque. So from the policy perspective, the requests and recommendations that we're looking for, number one is to continue to provide the program in the first place. Between the financial support that's provided and the ticket price, really we see that this, without the program, or without the financial support, the program is not sustainable. And I'll provide you with just a really quick example. Right now, ticket prices one way from here to Albuquerque are $95. Without the financial support, one-way ticket prices are about $750. So that's really not sustainable given the size of the aircraft that we use. If we had a larger aircraft flying, we could probably get sustainable service. But for right now, without that financial support, the air service is not sustainable right now. Second, we're looking for a multi-year stable funding source. As you can see, the first source was a 2-year source. Remember, there was a 2-year funding stream, $3.5 million. That allowed us to get the program, pun intended, off the ground, and really allowed us to have some stability and see how our metrics were doing for the first couple of years. Since then, it's been a year-over-year program, and air service really needs planning from one year to the next and scheduling. So making sure that the pilot schedules are appropriate, and especially if we're looking to change the routes, that requires looking at the entire routing, not just in New Mexico, but through connecting through Phoenix and their other routing system. So a year-over-year program really hampers that scheduling and planning. So we would like the state to consider a multi-year stable funding stream so that that type of planning and scheduling can be done. The other request that we have is to establish a methodology for fund distribution. You'll also notice from the previous slide that we had $3.5 million for our first 2 years, but then that went down to only $1 million for the last 2 years. There really is no rhyme or reason to this point. There's no clear methodology as to how the funding is being distributed. Some cities get more funding than others, but it's not really clear how that methodology is put forward. So we're asking that there's a much clearer methodology that is presented through the policy. With that, Mr. Chair, that's my presentation, and I'm going to turn it over to Natalie for her presentation on housing.
Thank you, Andy. Natalie Green for the record, your housing administrator. So we are tracking a number of policy bills. Some of them are a little ambitious. We're uncertain if they'll actually make the call. The first is a source of income. So the city of Las Cruces already has a source of income discrimination within our code, so we're supporting the statewide bill. There's also eviction ceiling, which will come, we anticipate that also coming this section. There's also a consumer protection bill for mobile home parks, so, and that helps with some of the corporations buying out mobile home parks, raising prices, evicting tenants, and not giving them the opportunity to potentially co-op and purchase their own. The executive is also pushing residential uses in commercial zones, so I anticipate that this one will be successful in making the call sheet since it's being run by the Office of the Governor. This doesn't impact the city of Las Cruces since Realize already allows that, but this would impact the rest of the state. The biggest things that we're supporting and following is appropriation bills. So Housing New Mexico has two bills that are moving forward. The first is to fund the New Mexico Housing Trust Fund. That is gap financing for low-income housing tax credit projects. And so with the increase at the federal level, they anticipate needing an increase at the state level to have that gap funding. They're also asking for $500,000 for implementation of the Affordable Housing Act. That helps local governments create their plans and implement their affordable housing plans. And then the biggest ask is through the Office of Housing. They are pushing a multi-year stable funding for both affordable housing and homelessness. So they're looking for a 3 to 5 year fund, anywhere from $400 to $500 million. Some would be for affordable housing, and then a small set aside would be for homelessness programs. This is particularly important because of the continuum care NOFO, which hot off the presses, I just found out an hour ago that it's been rescinded by the federal government. So that's some good news for now, but we'll continue to monitor this, and we'll still be advocating for that flexible funding source for homelessness in the event additional problematic NOFOs come out around continuum of care funding. In terms of benefits, it increases our resources to both build and preserve affordable housing. It'll meet some critical funding gaps for affordable housing projects. It'll provide a more flexible, sustainable funding source for homelessness response, which in turn reduces some of the needs for emergency response. It'll increase our statewide capacity, especially as federal housing programs and homelessness funding becomes uncertain, and then it advances our priorities around neighborhood revitalization. So with that, I'll pass the presentation on to Chief Story.
Good afternoon, Mayor, Council, Jeremy Story, Police Chief. I'm going to talk about 3 issues. The first 2 probably are nothing new. These are things I've been talking about really since I was interim chief. The third one is probably something that's new. The first is juvenile crime, and unfortunately we've seen this throughout my time as chief, but especially this year with Young Park and then the most recent homicide kind of highlight the importance of this. We've seen just a level of violence go up in the last few years, and if you look at class 3 citations, you actually see it kind of trending down, but you see the severity of the crimes that are committed actually going up. There are far too many repeat offenders who are juveniles, and this is a snapshot from earlier in the year, I believe around mid-year. But we have 6 juveniles in Las Cruces who have 11 or more arrests, and we have 37 between 6 and 10. And the average person, when you ask them, either hasn't been arrested or maybe they forgot to pay a ticket and got a warrant or a DWI. But to have 6 or more arrests as a juvenile should be a red flag. It's been really challenging to address these because of the current mechanisms that we have. We don't have a really good way to intervene and stop, especially as it escalates, until that child commits first-degree murder, and then they're charged as an adult, and it's kind of intervention. But the goal, of course, is to do that, intervene before it gets to that point. This year, we've had 4 juveniles who have been charged with first-degree murder. Kind of along the same vein with just repeat offenders or frequent offenders in general. And when you look at evidence-based policing, there's kind of 2 main umbrellas. You have kind of place-based or hotspot policing, and then you have the fact that there's a certain group of people, which tends to be a very small percentage, that commit a disproportionate amount of crime. And we can call them repeat offenders, frequent offenders, familiar faces. But that is something that we've struggled with here as well as really everywhere. Our failure to prevent, or probably better said, to mitigate recidivism has resulted in a lot of damage to our community, our businesses, our citizens, and especially our victims. And just one area is pretrial detention. Now, pretrial, even if we changed it, it would not fix this because there's a number of issues at play that are resulting in these numbers that I'm going to show you here. Just as an example, if you look at Doña Ana County, we have 3 people who have over 100 arrests, 101 or more arrests. We have 8 people who have 76 to 100 arrests, 19 people who have 60 to 75, and 46 people who have 50 to 59 arrests. Now, if you go 40 to 49 or 30 to 39, that number continues to swell drastically. And again, going back to what I said earlier, most people either haven't been arrested or maybe made a mistake or two in their life. But to have this many people with 50 or more arrests should be a red flag. And then the final issue I want to highlight, and this one is probably new, is to modernize law enforcement training. There's several bills that are kind of floating around that are draft bills. Senator Maestas, who's vice chair of Senate Judiciary, kind of took this task on, but there's other people who have drafted proposed bills or model bills. And what they're trying to do is take the system that we have, which is built up over decades and decades. So what's happened is the legislature, there's an issue that's come up and they've kind of mandated training, let's say in the 60s or 70s. And then in the 80s, they've done that, in the 90s, all the way until a couple of years ago. And so you have all these different requirements that are in different places in statute or the New Mexico Administrative Code that have stacked on each other. And it's to the point now where I believe it's 51 hours of mandatory training in the 2-year cycle. And at the same time, law enforcement is required to do 40 hours of in-service. So now the mandates are higher. And I'm not even advocating to lower that. I actually think we need to do more training than that. But what's happened is it's made it very difficult for the Law Enforcement Standards and Training Council, which the legislature enacted a few years ago, to actually do their job. So what the bill does is different versions do different things. Essentially, they're trying to put the power in the hands of the council to create both requirements and curriculum to be more flexible. So if something comes up, we're not dealing with something that was important 30 years ago but may not be relevant now, but they can address AI and ethics in law enforcement. That's something that's coming up. We need to do a training on that. They can develop the curriculum and make the mandate now, which they don't really have the power to do that. That is all I have at this time. I'll call up the Quality of Life Director, Carol Bray.
Thank you, Chief Story. Good afternoon, Mayor and Council. Carol Bray, Director of the Quality of Life Department. And I'm here to request your support for something that actually happens every 2 years through the legislature, but you may or may not be aware of this. And this is the New Mexico Library Geo Bond. There will be another one in 2026. This is something that happens as part of the General Obligation Bonds Bill, and that is developed by the Legislative Finance Committee every 2 years. That includes all types of libraries, including public libraries, academic institutions, senior centers as well. So our senior center process, through which we get funding for projects like the Munson Center Edition and the Sage Cafe Edition, our Meals on Wheels vehicles, those also come out of this bill for another fun fact. So this bill for the Library Geo Bond is supported by the New Mexico Library Association every year. They work closely with legislators to formulate this bill, and it has been approved by the voters for the last 22 years. So we hope it will continue to have that great record. For this coming session, the New Mexico Library Association has requested an increase from $19 million to $24 million for libraries, which would also benefit our libraries here in Las Cruces. And here's what the local impact is. Basically, public libraries receive supplemental funding based on our population. Las Cruces Public Libraries received about $466,000 $6,000 in 2022. We're expected to receive about $500,000 in 2024, and then if this $24 million increase were approved, we would receive $554,800 roughly from that increase. Funds have been used to enhance many of our popular resources, our e-resources, our digital books like Hoopla and Libby, which I know some of you are familiar with, to purchase traditional books, print materials, upgrade library furnishings and equipment. We cannot use these funds for construction or staffing, but we do use them to leverage our construction projects. So for example, Brannigan Library would be able to purchase furnishings and equipment with this funding for an expanded facility. Basically, what NMLA told me is that since this bill is already under development, we're requesting your support and want to let our legislators know how much we appreciate these funds because this will go out of the legislature to the voters for approval. So I want to make that clear that this is a bond issue that goes next to the voters, but it originates with the legislature, and also how essential these funds are to library service in Las Cruces. And I will now move to questions, and we all will stand for questions. I'll turn things back over to Christine. Thank you.
All right, thank you, Christine. Councilor Grant?
Thank you. Yeah, not delving into any of the individual items yet, but just for people listening and perhaps like me are like, wait, didn't we just do this last week? So I feel like some explanation would be helpful. And Natalie, actually, Christine, you're always amazing, and anyone can feel this, but Natalie actually used some vocabulary when you said the governor is putting it on the call. So I don't know if anyone would like to explain, yes, this is a 30-day budget-only session. However, the governor has powers. Go for it.
Correct. Mayor, Councilor Graham, you are correct. The governor can bring certain policies forward. I know the public safety ones are big on her list. Again, of course, there's no guarantee that they'll be passed, but she does have that prerogative to bring certain ones forward, and public safety is one of her big ones, so.
Okay, great. But yeah, just kind of pointing out that this is an evolving situation. You know, as Natalie also mentioned, things are changing as we speak, and we're also starting to see, you know, the hints are out there. There's, you know, additional, you know, been made aware of some potential gun safety legislation emerging from some legislators in Albuquerque looking at gun dealerships. I'm going to share that with you, Christine, so you can share with the larger council. But yeah, just to say this was not like a ball drop from last week, just that this is constantly emerging and is largely tied to powers vested in the governor themselves.
Correct. And Mayor and Councilor Graham, just want to mention too that we won't see a lot of these policies until January when they first drop, so we don't even know what they're really going to look like at this point.
Right. Yeah, no, we're in speculation mode, yes. But thank you.
Thank you. Mayor Pro Tem.
Thanks, Mayor. Thank you, Christine, and thanks to the staff for coming back a week after we had this conversation about legislative priorities at last week's regular meeting where we voted on this. I think it's important we have this conversation because even though we really are trying to move away from endorsing any one particular piece of legislation, given the feedback and advice we've gotten from Larry, who literally does this for a living, right, in terms of how one piece of legislation can look a certain way the first day of session and completely different by the 30 days. So we're, you know, trying to do more umbrella type of sort of advocacy or support, if you will, like housing, public safety. And especially because the 30-day is even more, I don't say volatile, but certainly volatile than the 60-day. So I do think that it's important we're having this conversation. I think for me, what felt really concerning last week was that we voted on this big sort of item on legislative priorities, and what I saw on social media after was that Chief Story had meeting with the citizen group specifically about his own legislative priorities. And to me, that felt, and I've expressed my concern to both Chief and Ikani about this, but wanted to name it publicly because that's the work we do. And I think it's important that we are aligned as a city, that we are on the same page, and even when we're not, that we're able to have public conversations about some of these things. I think for me, perhaps it wasn't intentional, but the impact it had of that decision was that the city council does not support Chief Story and public safety policies. And to me, that feels, in this moment in time, detrimental to the kind of trust that we're trying to build with our community, to the kind of important work that we're trying to move forward in our community. And, you know, I think especially when it comes to public safety, I feel like there continues to be a rift between council and LCPD, and I hope that that's not true. I hope that that's just what I'm sort of looking from the inside out. And, you know, as we see collaboration with the Trump administration, even though the majority of this council is really trying to push back on that, even if it's immigration, quite frankly, I feel like it's a lot of things, because the, you know, Trump administration has really set a tone that has said, we're going to be high on cruelty and low on competence when it comes to navigating issues of immigration, issues of homelessness. And I just want us to better navigate these public conversations together, because that's how we're going to get important work done. And I just felt very discouraged by that last week, and certainly hope that in the future we can just plan better, especially because I think for Larry doesn't work for one particular staff member, right? Larry works for the city. And I want to understand when someone asks me about some of these priorities, I want to be able to feel like I know what I'm talking about, and because I should, that's my job. And so I want to note that. You can respond if you wish, you don't have to, you can if you want to. I just think it's important that, you know, there's going to be criticism no matter what, whether we as electeds or as members of the city are fueling to that or not really is the question here. And I would prefer for us not to be, and to show a better, more united front, especially when it comes to the issues that are most challenging and facing our city. So thanks, Christine.
Thank you.
Whether staff go through you, Christina, would like to just request, as soon as we know what is on the governor's call, for staff to be able to tell you, and then you tell us, just so that we're, you know, updated as we head into our advocacy day. Thank you.
Mayor Councilor Bencomo, I will be working very closely with Larry. He's already on it. He'll be starting to review the bills as they drop in January, and then reporting back to me on which ones will fit into our priorities, and then I will be reporting that out to everyone.
City Manager, you wanted to go ahead, respond?
Thank you, Mayor Enriquez, Mayor Pro Tem Bencomo, thank you so much. City Councilor Ikani Tamopiao, City Manager, for those listening in, thank you so much, Mayor Pro Tem, for speaking to it. I definitely want to be transparent. This isn't on any of the staff, as you and Councilor Graham and all City Council are very aware. This came before you as legislative priorities and policies, and this wasn't on there. Typically what we do is, when this comes before council, we do our best to get them collectively, to get the policies and our ICIP together on the same agenda item, and it did not happen. And I'll take that as a city manager. This is not anything that any of the staff today planned or intentionally, but this is something that we typically do historically, and that one is on me. It wasn't intentional by any of the staff here today, but I appreciate you bringing this forward, and this is something moving forward that we will bring together and as one agenda item, and as you mentioned, to show a united front on this. It's very important, as you mentioned. So this is not something that I did on purpose. But I appreciate you bringing this forward because I know you want to make sure that it's transparent for everyone watching as well. And we appreciate the grace that you and council has had on this topic, on these various policies, and we appreciate you bringing forward to the public. Thank you, Mayor Pro Tem. And Mayor, that's all.
Okay. Thank you, Connie. Anyone else? Yeah, I just want to say that we understand that it's a 30-day session and it's mostly financial, and these are some of the things that the governor could call, so we want to make sure that we are aligned with that. We just witnessed a presentation earlier on the mobile integrated health program and the success, and that all started with repeated individuals, repeat offenders of utilizing the 911 system. So we had to be proactive in order to make a difference in our community. And I believe that what Chief Story is presenting with the repeat offenders is in line with being proactive instead of reactive. And we have to be ready when the governor calls to be able to discuss this and to say, as a mayor and council from Las Cruces, we support this because we want to see a difference made, just like we saw with the MIH and with housing the same way. And Carol, thank you for bringing that up with the GO bond. It is important that we are in the forefront of it and being able to take advantage of those. The question I had for Andy was, I totally agree with it, creating services for our residents and opportunities for our businesses, but do you have any numbers since 2023, or what is the demand for these type of flights?
Mr. Mayor, we have been tracking our ridership and what are called load factors. I don't have the numbers with me, but I have them available and I can send them to you this afternoon.
Okay, thank you, Andy, I appreciate it. Mm-hmm. All right, thank you. I think that was it.
Thank you.
Look for a motion to adjourn.
So moved by Flores.
Second.
This is on a motion to adjourn the meeting. Councillor McClure?
Yes.
Councillor Matisse? Councillor Graham?
Yes.
Councillor Curran?
Yes.
Councillor Flores?
Yes.
Councillor Bencomo?
Yes.
Mayor?
Yes.
Thank you.